Good morning and welcome to our weekly podcast from the Seneca County General Health District. And as I usually do, I will start with our numbers here in Seneca County. As of right now, we do have 18 confirmed cases, and of course that includes the two deaths that we have had. If you looked at the ODH website, you will see that they have 19 listed. Over the weekend, we did some searching and investigating about a case and found out that it actually was not a Seneca County resident who, when it was entered into the database, it was indicated as a Seneca County resident. So our nurses have been working with the state department to get this straightened out, and they will take that off when they have that figured out. Also, I'm going to mention, and this is something a few weeks ago I said I was going to avoid mentioning much, but they are doing some blood tests now, which indicate when someone has had the COVID-19 infection. And we do have two, what they are calling probable cases because of blood tests, but there also are guidelines which have to be met in order for those to be considered confirmed cases. So we're working with the state on those two probable cases right now. And when we confirm that, we will update those figures. We have no hospitalizations right now, and 13 people have recovered. At the state level yesterday at 2 o'clock, there were just over 32,000 cases, confirmed cases, and 2,002 deaths. I've been looking at some studies that have been done. I'm always interested to see what kind of information has been studied in regard to the COVID-19 outbreak. And on Sunday, there was some information released from a study that was done in China on wearing masks. And it did to determine if that significantly decreases the risk of transmission. And the study was conducted by a team of scientists in Hong Kong. They found that the rate of non-contact transmission when both people were wearing masks, the particles, the airborne particles dropped by as much as 75% when masks were used. So I know there's been controversy and some people wondering how effective masks are, but that does show that it does make a difference. Also, another research project that has been done was done in Germany looking at social distancing. And what they did was first, they canceled major public events like sports competitions and trade shows, much like was done here. And then following that, they closed establishments such as schools and bars and restaurants. And then third, finally, they looked at containment measures that were aimed at limiting contact between individuals as much as possible. And all of these measures were found to reduce the spread. The one that had the most positive impact was in restricting the contact of individuals. So that does show too that dramatically decreased that spread of COVID-19. So I think what you've been doing here in Seneca County definitely has been helping and reducing the risk of spread. I also want to mention that yesterday the governor announced that they have a new congregate care unified response team that will go out and test residents and staff members in Ohio's nursing homes, as well as in some other congregate settings. And it will be done by medically trained individuals within our National Guard. And that is beginning this week. In fact, today here at the Tiffin Developmental Center, which is one of 8 developmental centers in the state that will be tested, they are testing the staff. Now, this doesn't mean that there's been an outbreak there. What they've been wanting to do for quite some time is track the incidence of infections in different populations throughout the state. And we know that there have been some areas where long-term care facilities have been greatly impacted by the number of cases. And they are thinking that because staff are the people that are going in and out of the facility, that we will find that there are some staff members possibly who have positive tests. And that's why that measure is being done. If there have been outbreaks, they're going to do both staff members and they will do residents who have been in contact with COVID-19 infections and that are assumed to to likely be positive. So we should be getting some information about the results of those tests. So it'll be interesting to see exactly what has happened. Today we have with us John Spar from the Emergency Management Agency, and he's going to talk with you about what's happening in the county. And before I forget, I do want to remind employers, since we've had some more business places opening up, that there's been some confusion about whether masks are required or not. And for employees, the governor's order does say that employees in workplaces are to wear masks. They are not just recommended, but they are mandatory. So I'll turn it over to John and then come back to you a little bit later. John, good morning. Good to see you.
Good morning, Beth. Thank you for having me on this morning. I appreciate the opportunity to talk to Seneca County and meet with you here on this Zoom conference call. I would like to put out there, you were talking about the masks and there's controversy about the masks. Related to that, yesterday on the governor's press conference, he interviewed somebody who was recovering from being infected with the virus, and it was an eye-opening look into a recovery. And I would urge everybody to go to Ohio Channel's YouTube page and take a look at that press conference and watch that interview. This gentleman in the middle of May, here at the end of May, was on, he was still on some oxygen. He was a fairly healthy person prior to contracting the virus, and that happened mid-March. For those people who are getting conflicting information on the internet and through Facebook, et cetera, that this virus is no worse than the flu, I would urge you to take a listen to that interview and see how that virus can affect you if you are susceptible to it. It will help define your best practices, and as you decide whether or not to help protect yourself and your loved ones by wearing a mask or doing some of the other things that have been suggested. I just thought it was a very good resource, and I hope people take advantage of that. Some things going on in the county. Let me get this information here. It's on my other computer. I would like to, first of all, encourage everybody in the county to sign up for our wireless emergency notification system. It's simple. You can do it in a couple of different ways, and if you are, there is a number you can text to get signed up automatically. I will warn you that if you text that number, if you go to our Facebook page and the Emergency Management Agency Facebook page, you'll see that number that you can text to get signed up. However, that will sign you up for every notification that we put out. For example, this morning we did put out, and we do this regularly, notifications about road closures in the county. If you're not interested in knowing the road closures, then you can customize your alerts. And if you have trouble doing that, you can contact us here at the EMA, and we can help walk you through getting signed up for the things that you want to know about, like weather alerts, road closures, anything else going on in the county. The more people we have signed up, the quicker we can get you notified if something's happening. So please go to our Facebook page or give us a call here at the Emergency Management Agency, which is 419-447-0266. We have been putting out for the last, 52 editions, I think, a situation report on a daily basis, mainly Monday through Friday. We've decided to scale that back a little bit as information is now coming at a more steady rate. And a lot of that information has been repeated. So we've decided to cut that back to 2 days a week. That situation report, which is available, by the way, after it's disseminated, it's available to the newspapers and media. It's also available on the Seneca County Commissioner's website, senecacountyohio.gov. You can find that situation report on a daily basis. We are cutting that back to 2 days a week. Starting next week, it'll be Monday and Thursdays. We'll put out the Monday edition to give you the updates from over the weekend, like the numbers in the county and the state and what has transpired over the weekend. And then on Thursday, it will pick up information such as the commissioners' weekly board meeting usually, and anything else that happens. Now, if we have something happening between Monday and Thursday that is particularly newsworthy, we'll put out a special email and post those things on our social media, et cetera. So we're not going to miss any information. But just like you, going to every other week on the Facebook Live report, we're going to go to 2 days a week for the time being on our situation reports. Other things happening in the county. We've been, our job here in this crisis has been to support the health department in Seneca County in any way that they need. And one of the biggest ways was to handle the distribution of personal protective equipment to our first responders and to the hospitals, long-term care centers, et cetera. And the reports back is we've done a pretty good job with what we've been able to get. Supply lines are now starting to pick up, and we're starting to get those things that we didn't have even a couple of weeks ago. So your loved ones are being taken care of. Whether they're working on the front lines or whether they're being taken care of on the front lines, we're doing our best in conjunction with the health department and the whole county machine to take care of what's happening in our county and working closely with the state. I'm open to any questions, and that's the only report I've got for this week. Thank you very much.
Do you have any questions? Oh, no questions. Yes, as John mentioned, I want to thank him for being on this morning too, and has been a great support to us through all this, keeping the county going, and we appreciate that very much. As he mentioned, we have decided that as well, we are going to pare down our podcasts. As John said, things are leveling out. Information is not coming as rapidly as it was, and we want to keep things fresh and provide information as it's needed. So we are going to switch to doing our podcasts 2 times a month. We'll do that on the 2nd and the 4th Wednesdays at 10:30. So our next one will be on the 13th of June, and then following then on the 27th of June. Excuse me. Again on the 24th, June 10th and June 24th. So we will see you again then in 2 weeks from today, and stay healthy and safe out there. And I appreciate all that you're doing through all of this. Thanks so much. We'll see you in a couple weeks.